Hello, and welcome to She Leads Biotech, the podcast that celebrates women leaders in the bioscience space. I'm your host, Sharon Cox, CEO and Managing Director of CNA International, based right here in New York. And each week I'll be talking to women leaders about their work, their triumphs and challenges, providing invaluable insight into how women can unlock their superpowers and succeed on their own terms. So whether you're navigating your own career path in bioscience or you're passionate about science and innovation, I hope you're empowered and inspired by each episode. Today's guest's journey began with a childhood immersed in science, fueled by curiosity and hands-on experiments at the dinner table. After initially envisaging a career as an equine veterinarian, she pivoted to neuroscience research before discovering her true passion for tackling complex organizational challenges in consulting and operations. In this episode, we dive into her time at the FDA, where she helped build decision-making frameworks and develop agency-wide training programs. We also explore her candid reflections on imposter syndrome, the ongoing process of building self-confidence, and how mentorship, both formal and observational, has shaped her career. A major turning point came with a late ADHD diagnosis, transforming how she understood her superpower for visualizing and optimizing systems and leading her to become more intentional in her work and life choices. We discuss her approach to leadership, the importance of empowering teams rather than micromanaging, and the crucial need for scientists to develop people skills alongside technical expertise. Now leading operations at a biotech tackling diseases of aging, she shares her vision for supporting founders, creating better systems early, and even dreams of building third spaces for neurodivergent technical leaders to thrive. So please welcome the VP of Operations at Gordian Biotechnology, Kristien Van Vlasselaer. Kristien, hello.
Hi, how are you?
Good, how are you?
I'm doing all right.
Excellent, excellent. Well, listen, I really appreciate you joining us today, taking the time out to speak to me. Where am I speaking to you from? Where are you?
Yeah, I'm actually in South San Francisco in California in the Bay Area.
One of the things that I always like to know when I'm talking to somebody is how? How did you start? Did it choose you? Did the sector choose you? Did you choose it? How did it all come about?
Yeah, good question. So my background, I have a PhD in effectively neuroscience. I worked in cell biology, researching astrocyte migratory signaling. And I got there primarily because biology and science were a big part of my day-to-day life as a kid even. So I have family members in the industry as well. And so it was very common for us to talk science at the dinner table. We bring our work home and our kids listen. So I was listening and I got to see, I don't know if you remember, like Take Your Daughter to Work Day or something.
Oh, yep.
So I got to go to work with my dad and pipette things. And my mom was in HR, but also at a university nearby in a scientific area. And so I got to, science was a very early exposure thing for me. So I had a lot of benefit there. And then I did an undergrad in animal science and went to UC Davis, enjoyed that a lot, but knew pretty quickly that I didn't want to work with animals in that capacity. I thought I wanted to be an equine vet and spent enough time at the large animal clinic to know that I love horses and I don't want to do this every day. Both things are true. And so I pivoted and was like, okay, well, what do I really like about this idea of being a veterinarian? And I liked puzzles. I like solving problems. And so I did my PhD and my postdoc based on that kind of ethos of I like to solve complicated problems. And by the end of my postdoc, I realized I love problems and I love solving them and I hate this. Long story short, it took me to consulting, which is not a place I expected to be, but that's what got me more into operations and management strategy. So winding story of how science and operations both happened for me.
Okay. So, and I would imagine that being in the consulting world where everything is a puzzle at times, right? And it's like that needs to be solved, and that's a challenge. Must have felt quite early on as an this is the right patch for me to be. Talk to me about the consulting work that you did. What were you involved in?
Yeah, so after my postdoc, I was recruited to a life science consultancy at Booz Allen Hamilton.
Oh
They're
yeah.
East Coast based and very government focused. And I worked on the health team effectively, but primarily for FDA. And so it literally from day one felt like, when you drop a fish in water, I was like, oh, this is the thing that I'm supposed to be doing. Whereas previously I was doing fine, I guess, but I wasn't really thriving. The consulting ethos of let us help you help yourself, let us help you build systems and strategies and frameworks to make this work better, faster, stronger very much resonated. At FDA, I started by actually building out the first company agency-wide training curriculum. So they didn't have a consolidated training curriculum. I worked for the Office of Laboratory Safety, which is under the commissioner's office. And that was my first big girl job. And immediately also had a team of people under me, which was a small team, but I got my feet wet on the management side, got to do really build it from scratch. And so I built curriculum and training, which I had never done before. So I got conversant with kind of training and software development on that front. And then I kind of bounced around FDA doing different strategy operations management type work. I worked on the biosimilar review template that hadn't been built previously. So I worked on that for a while. I worked primarily in decision analytics and decision-making frameworks. So the benefit risk framework in the Office of Program and Strategic Analysis, they are a group that supports review teams in their most difficult cases. And so my team worked with them to help convert qualitative data into quantitative metrics to help them make better, stronger decisions, especially in high uncertainty. So that was again, my team kind of kept growing and my work kept growing, and I really kept getting more and more complicated problems to look at.
That is so fascinating because whilst doing, lost my train of thought now, pick this back up again.
There.
Yeah, done that. Okay. I want to get on to mentoring. So that's where I'm trying to get to. Everybody that I've kind of spoken to superficially all seems as if, and I did that, and then that was successful, and I did that, and I went there and I did that. But we all know that that's not really the case. What were the challenges that you found going into this consulting work, into all of these different areas that you were put into, and how did you deal with them? How did it become that you were like, oh yeah, this is just natural for me to do?
I think, just to be completely candid with you, I think we do ourselves a massive disservice by not acknowledging to younger people that everyone is making this up every step of the way. And the pretense that like you were born in a pantsuit with heels on and that you figured it out and you bootstrapped your way, like, yes, everyone works hard and they make stuff happen, but nobody has certainty up front. There's no, this is the path and you will be successful if XYZ. There's a tremendous amount of luck and right time, right place involved in all of this. And so I think the biggest challenge I had early on as a consultant was imposter syndrome, right? This feeling, and even in especially my PhD, I felt like, okay, any minute they're going to find out that I'm actually dumb and I tricked my way in here. And I can't say that fully goes away. I think you just build an evidence base for yourself that you trust and believe in, that you are capable and accomplished and can do things. At this point, I just try to focus on what I can control, right? The things I can't control are always going to be challenging because you want to control them, but it's a waste of energy. But the things I can control and influence, that's what I focus on. So when I do, I guess initially as a consultant, I wanted to demonstrate how hard I could work and how dedicated I was and how bought into the mission I was. And all of those things are still very true, but they don't dictate my self-worth, my self-esteem in the way that they used to. And honestly, that's been the biggest challenge of my career is one, I wish someone had told me up front, everyone, every step of the way, no matter how senior, is faking it till they make it.
Yep.
And they look like they know what they're doing. They are probably right to some extent, but they're making up part of it. Or they've done this before, and that's why they look so self assured. And you won't get there until you get there, and all you can do is a good job and work hard, but don't let it be the be all end all of your life.
And did you have mentors as you were starting through your career, that the people that kind of helped you realize you keep going and things like that?
Yeah, I think we all find people in our lives, good and bad actually, that become your mentors, right? So, similar to we learn most from our mistakes, I think I've learned a tremendous amount from just observing people that I either admire or that I go, oh, I don't ever want to end up like that person. And yeah, you're mentored a little bit passively by just the environment that you're in
Yep.
and the people that you see. I have definitely had the benefit of some very proactive, helpful, kind mentors that have helped me along the way. My PhD advisor was incredible. I had some really great mentors in consulting, and currently have a handful of people that I are kind of my go-to calls when I want, especially like a female senior leadership perspective can be difficult to get your hands on. So when
Yep.
I find people that I admire, I try to stay in touch. But yeah, I think there's also with mentorship this idea that someone can teach you every step of the way or coach you. And I think there's broad strokes coaching and there's very detailed tactical advice that you can get, but the in between is still kind of all you
Yep.
and your values and your work.
And that's the inherently bit of you that's come from all sorts of outside influences as well. It's not a work thing, is it? I don't find it tends to be a work thing. It's much more other influences that make you who you are. Right. So what was the next stage of your career? Where did you go from the consulting area?
Yeah, I really enjoyed my time consulting. Towards the end of my time there, I was there a few years. COVID started and our
Yay.
workload, I know, right? My husband and I were both consultants in DC, and so our workload actually just skyrocketed. We did not slow down. We also had an 8-month old that also didn't have daycare all of a sudden. And so we built kind of a mini daycare in our kitchen area and we rotated hours. We had like a little bit of a clock in, clock out system. And we both worked kind of 24/7, and our son was with us, which was pretty incredible. As far as COVID goes, I know a lot of people had a much, much harder time than we did. But at one point, we just were like, this is not sustainable. And I had already been kind of considering different work, ended up coming back to the Bay Area where I grew up, where my parents are. And I was working at the time for a company named Revance. They're more of like a mid to larger size biotech, and started doing program management there, doing some management strategy work. I worked kind of all over the company, whatever program management type work needed to happen. I worked on a BLA filing. I worked with a biosimilar partner that we had, and then really just got into, I think this is a theme. When I see a problem or a challenge or a system that's not functioning fully, I can't help myself. I stick my nose where it may or may not be welcome, and then I try to help. And so I actually worked on their clinical supply chain workflow, and realized pretty quickly that it was just companies that scale and go from this smaller biotech to larger, especially that kind of clinical leap. Sometimes you find that even clinical companies or clinical level companies have a lot of old school, like email based strategies and workflows. And at some point that breaks down and you miss a shipment or you whatever happens. And so I restructured and got to kind of put my consulting strategy mind on a very tactical biotech problem. And again, I think that's that complex problem solving, but also realize that workflows and optimization are a favorite space for me to work.
And that you've mentioned it a few times of, I like puzzles and I just have to do this and I have to do that. And you actually have a superpower, right? In in what you can you talk about that?
Definitely. Yeah. I kind of joke about seeing the Matrix. I don't know if maybe that's a dated reference at this point. I'll accept it. That's fine.
Let's leave it with that because I can't think of another one.
But yeah, I especially as a consultant started to realize like whiteboarding is my love language. PowerPoint is a love language for me. I really love building out visuals that are communications for people. And I thought that that was just a normal thing that everyone does. And I realized over time that that's kind of I don't know, unique or different way of thinking. And so just kind of observing that people think differently. One of the things that's happened and is relevant to me in the last 5 or so years, I've been diagnosed with ADHD. So late diagnosis of ADHD. I was 35 when I was diagnosed, and I didn't really see it coming. There's kind of a joke that neurodivergent people flock together, and it turns out that's true. I have a couple of girlfriends that were kind of bringing it up and saying, well, guess what? I just got diagnosed. Okay, sure. I was like, well, my job is literally to be organized. That I don't have ADHD, obviously. But after having my second son, I realized that I was just worn out. I was exhausted all the time. And so I was going to a doctor to try to figure out, well, what's that fatigue? Yes, you have small children, fair enough, but this feels like too much fatigue. And ended up getting a review with a psychiatrist, and they said, well, have you considered ADHD? I was like, no, not really. I have a couple friends that have talked about it, and went through the diagnosis process, and turns out, yes, ADHD. And it's a little bit, I liken it to when you have too many apps open on your phone, your battery dies really quickly. So my brain was trying to do all of this coping that it had been doing relatively successfully in my life, and I didn't know that they were coping mechanisms. And so I just had been overwhelmed to the point that I had kind of an ADHD burnout situation. And I got medicated. I've been on medication now for, I don't know, a couple of years. And it's fantastic. The first time I took it, I was like, oh, it's like my controller was plugged in for the first time. And I realized that I had been playing on hard and everyone else was playing on easy.
Oh, wow.
So this, like, that visualization and seeing the matrix is my ADHD superpower. But it also can be a detriment, right? If you don't know how to manage a neurodivergent brain and you're not being kind to it, you can really put yourself in a hole. And so where I am now is very, very different from my fatigue hole. And I'm, yeah, very happy to have kind of harnessed my superpower and see it for what it is.
Excellent. And how has that impacted your work going forward?
It's made me much more intentional about what I want and decide to spend my time on. I've realized in the past, I used to think, well, you just don't like doing that thing, or you're bad at it and you should work harder at it. I'm like, well, okay, yes, there's a certain amount of obviously growth and development that you can do. But ADHD and just neurodivergence in general has made me realize, like, there are tasks that my brain is uniquely suited to, and there are tasks that other people are going to be better at than I am. And I don't have to do everything all the time to demonstrate that I have value and that my work is important or whatever.
All right.
So I'm just much more intentional. I also realize more and more how many women like me there are, and these, especially in leadership roles where you wouldn't necessarily expect to see a lot of disorganization. I think there's ADHD is such a misnomer. Attention deficit, yeah, right. I have the most intense attention ability for the things I love and am passionate about. If you make me do tax paperwork, watch me check out so hard. Will not be interested in that component.
Isn't that like most people? I mean, you know, I if I need to do something creative or whatever, I'm all over it. But if I have to stop and sit and think about something, and I'm like, I'm not interested at all.
Yeah.
So I don't know whether that means I need to be tested or whether it's and how does is there a defining line of, is there a real tell that oh yeah, that is ADHD, or is it that, you know, we basically could all have it. We don't know. I only say that because a very, very good friend of mine in the UK, who actually worked for me for about 10 years, was this whirling dervish of an individual. She was all over the place, and she would be woo, and then she'd crash and burn, and then she'd woo again. And I just thought that was her. She was fantastic at what she did, and still is. She's still amazing at what she does. And it was only a couple of years ago, after I'd moved here, and we stayed in touch, and she contacted me a couple of years ago and said that she had been diagnosed with ADHD, and the difference that it's made in her life of actually having some verification, yeah, this is it. Did you find that? Was it almost like a, oh, okay, kind of moment?
Yeah, and I think this is the beauty and kind of the challenge of neurodivergence is it's a spectrum, right? There's humans fall on a spectrum, of course. And so the way that you are diagnosed, there's a checklist and there's a certain number that you have to check off to be within the range of ADHD. Like, people can be forgetful, but then there's other tells and other signs along the way, right?
Right.
And so what they'll do too is because most people are diagnosed young, women are kind of an exception to that unless it's very, very blatant. And so I think that's changing and improving, but at least when I was growing up, I don't remember anyone in my cohort, any woman, any girl in my school being diagnosed. Could be that I just wasn't aware, but I don't remember it being a topic. I remember boys' diagnoses being a topic. And I think it's because boys present as disruptive, like physically disruptive. So they are literal whirling dervishes. And so attention deficit hyperactive, yes, very hyperactive, and they're disruptive to the class. And so when I was doing my diagnosis, I was like, well, that wasn't my case. I was not disruptive. I was annoying to my teachers because I had a million questions, and I was very logical and wanted the full explanation, not just what they were willing to give me. I'm sure that was annoying. But along the way, I had these kind of moments where it became, one, very clear that women present very differently from men. Girls present differently from boys with ADHD, and also that I had been masking my whole life because the psychiatrist was saying, well, do you ever have trouble, or did you have trouble sitting still? I was like, no, I sat at a desk just fine. I was also a very competitive youth gymnast. So I was at the gym every day for 3+ hours, including weekends.
Right.
And yeah, that's where my energy went.
Yeah. So it was basically utilized rather than it being a fidgety kind of up and down every minute. It was all condensed into one activity area that would kind of wear you out from there.
Inadvertently, right? And I also realized as I was speaking to the psychiatrist, I was sitting on my hands. And so I'm like, well, no, I'm not a fidgety person, but I have taught myself, coached myself in all these little ways to manage my fidgety or my inattention. And I've since stopped doing much of that. I've leaned more into where am I safe to unmask, where I can do it when I need to do it, but it's intentional now rather than unintentional. I think that's the biggest thing I've learned is that often we are conditioned and coached and taught to do these things as small people. And then we grow up and we don't realize how much of our processing power is working on that rather than interesting, complex things that our brains are much happier working on.
Right.
Been the biggest shift for me is focusing on the things I want to focus on and leaving a lot of that societal management on the side.
So who are you with now? Who do you work for and what do you do?
So I'm at Gordian Biotechnology in South San Francisco, and we're working on complex diseases of aging. So we have a variety of programs, and I'm our VP of operations. So I focus primarily on, the operations of the company, which spans facilities, EH&S, human resources, IT, what keeps a company moving and going.
Yep.
But I very much employ my project program management strategy role here. And we're a smaller company, so we're a Series A startup, and we're in process of growth and fundraising and so on, as we always are.
Yep.
But there's about 40 people on the team, and I do a lot of R&D operations. So it's kind of a tie-in between project management and laboratory operations, and just making sure the team has what they need in a structured way, in a way that we can track and manage. I work closely with our finance lead, and then with I'm on our executive team. So we all work very closely. It's hard not to when there's 40 people.
Yep.
So Yeah, it's
And how do you handle, you mentioned you have two children. You haven't had any more since you
no,
spoke about that
God.
bit in the last 5 minutes, just the two. Okay, that's good. Um, and so, how do you manage your time now? How do you know your priorities? How does it work as a working mum with two small children?
Good question. I think it's a work in progress. There's no perfect answer, unfortunately. I think it's a lot of just there's that some story about you're always juggling balls at different things. Some are rubber and some are glass, right? And knowing which are rubber and can hit the ground and bounce and which are glass and can't. That's just been a big part of my journey since having kids, is understanding which of the things I'm juggling are absolutely critical and which are optional or can take a dent or so.
Yeah,
And so a big thing is, yeah, if you're in a leadership role, you have accountability and responsibility to your team and to the work you're doing. But that's not as important to me as my children.
yeah,
And so it doesn't mean that I'm at every single drop off and every single pickup. And I can't volunteer at every child thing at school, but I am very intentional. And the company is also very flexible about, yeah, working parents. If there's a field trip, I sign up for that and I take that day and I go do my field trip. And maybe I work in the evening, maybe I work on the weekends. I tend to do that anyway.
yeah. I was going to say, and what's different?
Right. So I think it's really just about finding that balance for yourself, and it's different for everyone. I've met folks that there's different phases in your life too, right? There's some
Yep,
folks that will, when your kids are young, you're much more home focused, and then as they grow and they get their own lives and are maybe not as interested in talking to you anyway, you can spend
yep.
a little more time on career. But for now, I think we have a pretty good balance, and my husband and I share a lot of load, and there's also really great apps and visualization tools that you can put in your home that are helpful too.
And a supportive partner, I think it has really got to be a key, right?
Yeah, yeah, and he works
Shout
full
out
time
to
as
the
well,
supportive partners. Woo!
right? You gotta have them. Um,
There we go.
he works full time too, and it's not in an easy, simple role either. And so there are weeks when he's traveling for work, and I'm working from home a little bit more. And then there's weeks when I really have to focus here, and he's doing more of the child labor.
Your situation and how you deal with your family life and things like that. How has that affected you as a leader of other people who work? Do you think it's given you a different perspective of the challenges that other people might face? How are you as a leader to other people with that for that?
Yeah, good question. Having children now, I look back at people I worked with previously that had kids, and I did not understand, right? Especially when I was younger. You just can't understand that I have done part of a work day before I get to my work day. And then
Yeah.
after my work day, there is
You've still
another
got
work
another day
day.
to go.
And so I think it's been a blessing to be able to. My kids are fantastic too. They're hilarious and weird and funny and all those wonderful things. But I think it's really just given me more balance and more appreciation for people's different situations, stages of life. When I was in my 20s, I could not have conceived of who and where I am now. And I'm sure that when I'm in my 40s and 50s, I'll look back at this and be like, oh, that was, you didn't know, wow. But I think as a leader, I was talking to one of my direct reports about this the other day, that it's your responsibility and obligation to empower and to support your team. And I think a lot of managers make the mistake of thinking that when you're managing, you're tasking. You're like, well, it's different. I want to build a team and a culture and a group of people that are empowered to function and to learn and to ask questions when they need to, but mostly to just go do their work how they see fit. And I think that should not sound as like a revelation, but it can be a little bit, I think.
In some instances, yeah, I've worked in situations where it's almost been, okay, so
Yeah,
I'm an
that's a
adult, am I?
great
Do
way to
I
put
have
it.
to behave like one? Yeah, you kind of do, really. So it's Yeah,
Yes.
you think it's obvious, but obvious
It's
isn't
not.
always the easy answer. So what advice would you have for somebody coming into the space now? Obviously, that there's been some challenges within the bioscience space, and I'm sure there will continue to be challenges. But I was at the Bio 25 event recently, and I know that that there's still it's still such an important arena, and there's the lives that are changed as a result of the work we do is you guys do, not me. So many lives that are changed by the work that you do. What can you say to people to kind of keep coming back to it and still keep looking at it as a career and don't be afraid of it or not?
Yeah, I think there's a handful of, I mean, a lot going on right now, right? So I was in DC area a few months ago for personal reasons, but got to reconnect with some former colleagues from consulting at the FDA and some former clients at the FDA. And I just want to give a shout out to our FDA and agency and government employees that have been affected recently. And I hope they know, and I tell them their work is incredibly important. We see it, we know, and what's been going on is not acceptable in so many ways. I think there's still very much hope and absolutely a need for biotech, a need for pharmaceuticals. I think someone was reading something recently like, no matter what your policy is, people will still keep getting sick. People will still have genetic disorders. People will still, the illness does not go away just because you will it away, unfortunately. And so,
Yeah,
pendulum swings, and there's not much we can do about that. But I think there's also an adage that some of the best, strongest companies are born out of times like this, when it is very
yeah,
lean and when the market is very discerning, to put it as kindly as possible, on where and if they allocate money. And so I hope that people recognize and know that the work is important, and take care of themselves mentally, because these kinds of cuts and these kinds of I don't know, denigrations of science and fact can be
yeah.
incredibly wearing, and psychological toll of that can be exhausting. And just knowing that what we do helps people and will help people, even if it doesn't right in this moment. Everything that we learn is improving science and
And the
improving
lives
the
of
science
others.
we know. And so
And I
moving a
guess,
bit oh, go ahead.
no, go on. I was going to say to what you were saying, I guess that's really, it's the people who really want to be in the space will still be in the space. They'll
Yeah.
make it happen. They'll find a way, right? In getting things through.
Yeah. Yeah. And I think the biggest thing that I would say is follow your passion.
Mm.
I think it's, at least I was messaged or taught when I was young, do something productive, do something technical, do something that matters, and then the other stuff you'll be passionate about. And I realize now I kind of stepped maybe sideways into the thing I'm passionate about, which is really problem solving and systems dynamics and analysis and improvement of operations. For scientists, their passion, the true bench scientists that light up when they have a scientific problem and
Mm.
don't have my thing of like, God, I hate this,
Yes.
um, at the bench, those people will stay at the bench and they will continue to love doing what they're doing. I do get a lot of R&D folks that are at the bench and are progressing and are maybe managing a few people, and they're like, okay, well, I like this, but maybe I don't want to be at the bench forever. How do I make a leap to something else? Or how do I become the more senior manager? And the biggest suggestion that I can make is investment in people skills. I think we do, in the United States and elsewhere, we do scientists a massive disservice where we do not teach them outside of the technical space. We don't teach ethics necessarily. I think there's an implication that ethics, like scientific ethics, is taught along the way. Not necessarily. Some programs do, but not all. I think, yeah, people skills, what a lot of people call soft skills, is I'd like to kill that term. They're not soft skills. They can be learned, and they should be learned, especially if you're going to be managing other people. I think we also do our teams a disservice by not teaching them about the economics and the marketplace that they're moving into, what actually drives decision making versus what, you would assume if you're a scientist that the best data will win out always. No.
No.
And it can be incredibly frustrating and like disillusioning when you've been taught for 30 something years that as long as you have good science, the marketplace will make space for you. Maybe depends on your market, depends on how, your payer provider situation is. And sometimes these terms are just not heard until you're in your mid 30s. So, if ever. So, I would suggest getting solid education on market, the econ, and then really putting those people skills to use early and often, finding mentors that value those things, because in the long run, I have seen more scientists hamstrung by their inability or unwillingness to embrace soft skills, people skills, sorry,
Yep.
than by almost anything else.
Yeah, that is definitely it's a topic that comes up time and time again, and I think certainly for people who want to go on to manage people, because it's a completely different skill set from what you've been sat doing. I know even from in the recruitment industry, when I first started, I was an awesome recruiter and always got the targets and always did the top sales and always did this. And then because of that, I was promoted to manage a team of other consultants. I was terrible, absolutely hopeless, because I just expected that, okay, so I just replicate what I do among 5 other people. You must all do what I do, and that's how you'll be as good as I was when I did it. And, as people were leaving, I was like,
interview can be very telling.
I wonder what that is. But nobody would tell me. It was just, and it was only when I said, okay, well, look, I'm obviously rubbish, so I'm going to quit this myself. And it was then that the really lovely, lovely woman, who was my boss's boss, actually took the time to sit down with me and say, I think maybe you need some training into managing other people, because it is a completely different skill set. Nobody's taking away from what you can do, but the next. And so, cut a long story short, I said, okay, fine. So now demote me and put me in an office with the most awesome manager that the company has, and help me to learn. And they did, and she was. And if she's still out there, Denise Moore, thank you very much. But otherwise, I just would have withered and died. I mean, I literally would have, I got put into this position with nothing, just an expectation that everything was going to be fine, and it really wasn't. And I see that so many times now, even with companies who allegedly have, management training courses and various things like that. It's still the same thing, that people are just expected to know how to do that, and they don't. So.
And management training is great, but it's like going to the gym and someone talking you through how to use the machines and then you never doing any reps, right? So the best case scenario is you can really describe to someone else how to do it, but you aren't doing it yourself.
Yep.
And so my biggest thing is, yes, read the books, read Radical Candor, read read the things that are out there that are so easily available. A big one is the How to Win Friends and Influence People. It's such an old...
It's so old school. I am looking at it in my bookcase as...
But
yeah.
It's old, and some of the examples are, how to sell hats, and you're like, oh, who's a hat maker? Okay. But it's correct. You have to sell people on the work. And scientists, I think, spend a very long time, or I should just say people that are technically trained spend so much time being technically trained that then there's this assumption like everyone knows what to do and we will just all function together. And I see it from leadership as well, where they go, just put 10 smart people in a room and they'll
figure it out.
And I'm like, yeah, kinda, maybe, if they figure out how to talk to each other.
Mm-hmm.
And so just investing in those skills and getting the reps early. So don't be in a management role before you work on this.
To do the work to get there. Absolutely.
So that by the time you're in your management role, you have like an ethos about management for yourself. I know that my ethos does not work for everyone. It's baffling to me that it doesn't work for everyone, but I have seen other managers be successful with different strategies and different teams. And I'm sure that there are people that would not work well with me, but by and large, I'm like, at least I know how I manage. I know how to do it, what to do. I recognize that there will still be things I can improve and work on. But my first role, when I had 2 or 3 people reporting to me, I made some serious mistakes. I lost my temper. I did a lot of what you said, where it's like, why can't you guys just figure this out? And then I had to take a moment and say, okay, it's not their fault, and it's also not my fault that I don't know how to do this. So I did find mentors, and I did have the benefit of seeing people do it well. I also had the benefit of seeing people do it really, really badly, and
Yep.
and to me. And so some of the best lessons I've learned are just, okay, I have experienced this, and now I will never make damn sure that I never do it to anyone else.
Absolutely. Yeah. And I think that's if you can come away with having learned that lesson, then, that's saving another generation from some sort of bad working experience. So I'm sure that will be the case. So what's next for Kristien? What's in your future? What's still to happen?
Good question. Yeah, I have a lot of thoughts all the time. I'm really enjoying the tactical and strategic kind of zoom in and out of small company operations. I really like this size, this type of company. I really enjoy the startup space. And I think, to some of my previous points about systems dynamics and people skills development and implementation, especially for R&D scientists, I care a lot that founders are not just supported with cash. I think there's a tremendous amount of other support that maybe doesn't get added or isn't provided early enough. And so a lot of these companies, similar to the supply chain, the clinical supply chain that I was talking about previously, if you put systems in place early in a company and then your company grows even a little bit, but especially if it grows massively, you tend to still kind of duct tape and put pieces together and make it work. Tim Gunn, that's nice. But I find that we're really doing a disservice by not teaching companies and organizations and founders early on that there are ways and strategies and studied systems that work better than others. And so one of the things that I'm passionate about is getting that information to more founders, to more small companies sooner. And so I'm not necessarily exploring massive shifts in my life right now, but in future, I would love to work in a space where I could kind of be like a drop-in SEAL Team 6
Okay.
later, and I don't know exactly.
Let me in. Be me in now.
Yeah, let me help you, and set things up and then kind of bounce back out until necessary. So yeah, I don't know if that would be in a consulting capacity or what kind of structure yet, but it's something I've been playing with. I've also been thinking quite a bit about creating third spaces for especially neurodivergent, highly technical women in leadership. We have home, we have work, and often there isn't really an in-between or a third space where you get to just be creative, kind of released from PowerPoints or data crunching or lunch making. So one of the things I've been thinking about is maybe doing that as a bit of a side quest, to support leaders and give folks a space to kind of have some breathing room. And in the long run, I don't know, maybe a more senior operations role. I'd love to co-found something one day and really take it from 2 people to 20 and beyond. But I'm not really too locked into the what has to happen. More of, do I get to do it? Do I get to do hard work that's worth doing with people I care about and that share my values? And that's kind of all I can ask for.
So not majorly ambitious then, Kristien, no?
No, it's fine. I just gave you a lot
All
of
these things
everything. It's
going
fine.
on.
I'd also like my kids to, grow up and be well adjusted,
I'd like to get world peace, and
Yeah, duh.
but I'll put that on the back burner. We've got other things to do.
Yeah, we've all got to work on that one. So
Yeah, tell me about it. Well, listen, thank you so much. I have to say, it's been an absolute pleasure talking to you today, and I wish you continued success in whatever you do, seems like there's quite a lot that's going to be going on. But whatever you do, best of luck with it. I look forward to continuing to follow your success. And if you have any ideas of, how to create those spaces, and there's a way that us as the show or me as an individual can get involved, then, would love to be able to support that somewhere along the way. So for now, it's been a pleasure. I'll let you get on with the rest of your day. And thank you very much for joining us.
Sounds great. Thank you so much, Sharon. Thanks for having me.
Bye-bye. Well, that's it for today's episode. Thank you so much for listening. She Leads Biotech is brought to you by CNA International USA, a woman-owned boutique search firm based in New York. If you're looking to hire talent for your company or want support in achieving your career goals, please reach out to me at contact@cnaint.com. I hope you enjoyed this conversation. And remember, the success of every woman should be an inspiration to another. So don't be afraid to share yours. Thanks again for listening. Until next time.